Good afternoon. I'd like to call the committee to order. Good afternoon, everybody. We have a pretty ambitious agenda. Of course, as we get close to deadlines here, I think most people are probably aware that we're going to get as far as we can now in our regular committee time, and then we're going to recess and continue starting at 6 o'clock this evening. So we're going to, first of all, we've got some minutes. We do have a quorum. And Representative Franson, would you like to move the minutes?
Oh, absolutely. I would love to move the minutes.
All right. Thank you. Representative Franson moves the minutes of March 8th, 2013. Is there any discussion to the minutes?
I think yours are right.
Seeing none, all in favor, please say aye.
Aye.
All opposed, no. Thank you, Representative Franson. The minutes are approved. So first bill up is House File 947, and that's my bill, and Representative Moran is going to take the gavel.
Okay, Representative Liebling, would you like to move your bill?
Thank you, Madam Chair. I move House File 947, and I believe I have a delete all. Yep. And Madam Chair, I would like to, so that House File 947 be recommended to pass, and I think it goes to the General Register. No?
Okay.
Where does it go?
Judiciary.
To the Judiciary Committee.
Yes.
Okay.
So Representative Liebling moves that House File 947 be recommended to pass and re-referred to the Judiciary Committee. Representative Liebling, could you move your amendment?
Madam Chair, and I have a delete all amendment that I'd like to put on to get the bill in the order in which I'd like to have it discussed. And that is the 0199 amendment, should be in members' packets, and so I would move the delete all amendment. If we could adopt that, then we can get to the substance of the bill.
Okay. Representative Liebling moves the A113, the A13-0199 author's amendment to get the bill in the shape in which she would like it. All those in favor say
aye.
Aye. All those opposed? Going well. Okay. The amendment is adopted, and Representative Liebling, go ahead and present your bill.
All right, members, even though this bill deals with the sometimes very volatile issue of sex offenders and civil commitments, but what you see before you is really a technical bill. It makes no substantive changes to the law. This came out of an OLA report, which, among other things, recommended separating the civil commitment statutes that apply to sex offenders and that apply to other folks who are mentally ill and dangerous. And so in the last legislature recommended to the department, or maybe required to the department, I'm not quite sure, but asked that this be done. And so we're back with the results of that, and it is very technical, and I'm going to ask my testifier to present it. And as you see on the bill, I have a couple co-authors, and I really appreciate Representative Abler and Representative Cornish co-authoring this bill with me, because I'm hoping that it's just non-controversial and that it will just, and the purpose of this, members, is to, because this section of law is very confused between these two kinds of civil commitment, it's hard for practitioners to work with the law, and it also means that moving forward, any changes that we make, if we can get this enacted, future changes will be simply easier to manage and easier for everybody to see what we're doing, and not make inadvertent changes to one side when we're really dealing with the other side. So with that, I'm going to turn it over to my testifier to walk you through the bill.
Okay. Could you please introduce yourself?
Yes. Thank you, Madam Chair. My name is Robin Vu Benson. I am a Deputy General Counsel with the Department of Human Services.
Okay. Please go ahead.
And as Representative Liebling indicated, the bill that's before the members is the result of a recommendation from the legislative auditor that was followed up in the 2011 session with a requirement by the legislature that the Commission of Human Services review the existing law in consultation with the revisor of statutes to recommend legislation, which you have before you, that clearly organizes the law and distinguishes it from laws relating to other forms of civil commitment. So it is certainly not intended to change anything substantive with the law, such as the standards for commitment or the standards for reductions in custody. There is some clarification that is done as part of the reorganization, and those clarifying items are described in the 1 or 2 page handout that members received that discusses some of the background and highlights items such as the terminology change of patient to committed person, using executive director rather than head of treatment facility. So those would be examples of not simply moving things around, but of providing clarification that distinguishes these statutes from statutes affecting other civil commitment populations. Now, the way that this bill works is kind of in several steps. The first group of sections, sections 1 through 8, prepare existing sections in 253B for renumbering. That's sections that need to have elements that are both in 253B and in the new 253D. Sections 9 through 19 have a lot of underlining. Those look like a lot of new language. For the most part, though, those are replications of existing provisions within 253B that could not be renumbered and needed to exist in both 253B and 253D. So that language looks new, but it's not necessarily new to the statute. Sections 20 and 21 provide guidance to courts and others on the construction and application of these changes, particularly noting that there's no intent to substantively change the law as it exists for populations still covered by 253B. And Section 22 does the heavy lifting of renumbering and reorganizing the statutes, some of which were tweaked earlier on in the bill, others that can just be renumbered wholesale. So that is the quick guide to what this bill does.
Thank you. Representative Abler.
Well, thank you, Madam Chair. And this is necessary to do. I was just kind of reading the annotated version, which I think could come out in a movie someday. I was especially taken by line 821, where it describes the rights of patients or persons committed under this chapter. The reason for that is preparation for moving 253D to 253D.02. I thought that was really nice to know, so I really thank you for all that helpful annotated stuff. I'm being a little facetious, but these recodifications are really actually valuable. They clean up law so we can read them more clearly. But it's anyway. Thank you, Madam Chair.
Thank you. Do we have any other questions by the members? Yes, please.
Thank you, Madam.
Representative Mack.
Thank you, Madam Chair. And to the testifier, I'm just wondering on just a couple quick questions. On page 14 and 15, the line is 14.27 and then 15.15. The striking of the word provisional discharge, I'm just wondering, does that fall in the category of you saying, you talked about some stuff looks new in there, it's not actually new. I'm wondering, is that or why is that being struck from the language in those parts of the bill?
Madam Chair, Representative Mack, that's an example of preparing existing language for its new place in 253D. When that subdivision is moved to 253D, it'll be part of several subdivisions relating to provisional discharge. So rather than provisional discharge being the title, it is the factors relating to provisional discharge that will be the substance of it, and it's in that new location.
Representative Mack.
Thank you, Madam Chair. And then just one other question. If I understand you correctly, and Representative Liebling, this is doing nothing to necessarily create or change our civil commitment process, just create this new chapter of law. And so I guess in removing the sexually dangerous persons and the sexually psychopathic personalities, I'm trying to remember exactly what those acronyms stand for, and eliminating the cross-references, I guess I'm just making sure that confident nothing's been forgotten and nothing is changing in the civil commitment process. This is just taking language from one section and moving into a new section in order to clean up what has gotten to be messy parts of state statute. Is that correct?
Mr. Benson.
Yes. Thank you, Madam Chair. Representative Mack, that is precisely correct. There is no substantive changes to how someone is civilly committed, the standards that are applied to that, nor to reductions in custody and the standards that are applied to that. This bill creates a working space for the legislature, if it were so inclined, to do some of that work, but it does not do that work.
Representative Mack? Thank you. Are there any other questions from the members? Is there anyone in the audience who would like to testify for or against? Okay, seeing no further questions, Representative Liebling renews her motion that House File 947 be recommended to pass as amended and re-referred to the Judiciary Committee. All in favor?
Aye.
All opposed? So, pass.
Thank you. Thank you, members. Okay, next we're going to move to House File 573, Representative Ward. And while Representative Ward's coming up, let me just remind members that we heard the public testimony on this bill on Friday, so we're not taking any more public testimony today as such, but we have a number of amendments, and we will be discussing those, and I think Representative Ward and others may be answering questions as those are discussed, but we did our public testimony already. So, let's see. So I'm going to move Representative Ward's bill. I'm going to move that House File 573 be recommended to pass and re-referred to the Committee on Government Operations. So, welcome back, Representative Ward.
Thank you, Madam Chair. Members.
And do you want to just I'll give you maybe just a couple minutes to maybe get us back in the mood here, kind of remind us of what we've got before us, and away from the exciting topic we just finished.
Madam Chair, I'm always all about the mood, so anything.
Well, go ahead, Representative Ward. Sorry, I guess I maybe caught you a little off guard there, but did you want to just remind us of
Madam Chair,
what we're doing here today?
Well, House File 573, as we talked about last Friday, is a statewide health insurance bill for education employees to create a large pool to minimize premium increases, to provide adequate, comprehensive, affordable, portable health care for all of our educational employees in the state. And I'm sure we had a good discussion on Friday, and I'm looking forward to talking about the amendments.
All right. Thank you, Representative Ward. So in the packet, we have the A8 amendment. Representative Loeffler.
Thank you, Madam Chair and members. What the A8 amendment does is that it takes off the PEEP HSA Health Savings Account high deductible plan as an option. And as I mentioned last week, I always look at this bill in terms of how it treats all school district employees, not just the high-paid administrators, but the teachers and also the lunchroom lady and the paraprofessional and some people who don't even get to earn 8 hours a day and yet are paid on an hourly basis to make sure it works for them. And I think the high deductible policy is definitely not affordable for those lower income hourly workers within the school district. As for a single person, they would have to pay the first $5,000. First amount would have to pay. They'd have to pay the first $1,500 to $4,000 in addition to their premium before the insurance would kick in. That's $1,500 to $4,000 before, plus their premiums before their coverage kicks in. That's a lot of money. And it does have a limitation of a $5,000 total out-of-pocket plus the premium. But for a single person working those kind of hours at the kind of pay we know they get, that I think is not affordable. For the family, it's equally troublesome, and we all know families have kids that have, get injured in the hockey game, or mom has problems with the pregnancy, or whatever the situation would be. In addition to their premiums, they would have to have an annual first dollar deductible of $3,000 to $8,000, depending upon what tier they selected, in addition to their premium, with a maximum of $10,000 a year. So if it was a typical credit premium, and I tried to find on the web, but I couldn't find, based on the Mounds View information that was provided last time, it wouldn't be unusual if you had a 50-50 split of the premium with the employer that you'd pay about $7,000 as just your premium out of your monthly paycheck. Or weekly, depending on how you're paid. In addition to that, you could be obligated to spend up to $10,000, with, like I say, the first dollar deductible being $3,000 to $8,000. I don't think that's affordable for many of our school district employees, so I would like to take this option off the table. That still lets the other two options within the PEAP program be available to our school districts, and I think they're more suitable for the range of public employees that we have within our school districts. And with that, I'd be glad to answer any questions.
Okay, Representative Johnson.
Yeah, Madam Chair, Representative Loeffler, how much is the premium in that policy you're referring to? That part of the policy?
Representative Loeffler.
Thank you, Madam Chair. And Representative Johnson, that's information I tried to get off the website. I couldn't get. Based on the information that we got at the last hearing from Mounds View School District, it looks like for a family high deductible policy, it would be about $1,200 a month. But that would be split between the employer and the employee, and I wasn't able to get a hold of Mr. Morocco to get any specific numbers. But it's typical that a family deductible premium is about $15,000 a year, so that feels sort of in the range to me. But I can't speak to that, and I did try to get that information. I was hoping Mr. Morocco was here so he could actually give us that number. But I think let's just assume it's a little less, because it's a high deductible, it's a little less than an average premium. But you still are, after you pay your premiums, like I say, you'd be responsible for that first $3,000 to $8,000 if you were in a family policy, in addition to your premium, and that is on their website. That is a firm number. Or if you were it was a single policy, it would be the first $1,500 to $4,000 in addition to your premium. And that, given the budgets that I know many school district employees have, I just think that's too high. The other two options are a better blending of less high cost shifting onto the employee.
Representative Ward, do you want to respond? Oh, I'm sorry, Representative Johnson. Go ahead, Representative
Let me
Johnson.
just expand this a little bit. I would like to know what a typical premium is. I understand there's three options, am I correct, under the bill as written? And I would like to know what is the premium for those. Frankly, it's possible that this would be a very wise choice. I've been a member in one of those plans. It was a rational choice for me when I had low income and I was young and relatively healthy. And so, but I would like to know before I vote on this bill, what can I anticipate the premium to be for these? Because this is an issue in a larger context. I appreciate, Representative Loeffler, your concern about the lower wage employees. I share that concern because I've heard with some frequency that those who are part-time workers or lower wage employees in our schools are going to have trouble with paying these premiums, and that's a legitimate concern.
Okay, Representative Ward.
Madam Chair, members, Representative Johnson, Thank you for the question. And Representative Loeffler, thank you for talking to me prior to the hearing about your concerns. We had a good dialogue and good talk, and I respect and appreciate the conversation that we had. While nobody can predict the future, especially with healthcare, especially with healthcare insurance, we don't know what's going to happen with any healthcare at this point. But we do know we can base our information on what has happened in the past, and so we have some data on that. And I would ask one of my testifiers to touch base on part of your questions.
Okay. Welcome to the committee.
Hi, my name is Courtney Dorinsky, and I am a negotiation specialist with Education Minnesota. Madam Chair, members of the committee, so thank you for your questions. When people decide to go into the PEEP program, one of the advantages is that it provides a lot of choice, and among those choices is the various levels of plans that are available. So there's the Advantage plan, which we sometimes call the high, the value option, and the HSA compatible option. About over 20% of members that have gone into PEEP have decided that the HSA compatible option is the right one for them. Often they make that decision based on affordability considerations because the premiums are significantly often less than the Advantage or the value option. So, and the other piece of this is with high deductible plans where they are paying a higher amount upfront out of pocket, we would often negotiate employer contributions towards that deductible. So the amount of the deductible doesn't always represent exactly what is coming out of members' pockets. So I appreciate your question. The other thing I would note also is that in different parts of the state, there are very similar plans to this one that have high deductible option components. And so this plan would be appropriate for those districts that have very similar plans to this one. So that's why we believe it's an important part of the PEEP program. And our members, have voted more or less with their decision to go into it by the numbers that have also enrolled in the HSA compatible option.
Okay, other members on the list. Representative Johnson.
Madam Chair, my question wasn't really answered.
Oh,
I would like to know what I'd appreciate knowing a ballpark cost, premium cost for, again, I understand there's 3 levels of plans, and use an example or last year's data, but I think if we're going to talk about, once you get into it's going to cost this and cost that, then you need to know the entire cost. Now I'm acting as a consumer. If I'm going to buy a plan, I'm going to want to know that. And so, can you get me a ballpark cost on the 3 levels of the plan? And you say there's multiple options. I want to be clear. There's 3 options. Am I correct? Okay. That's the information I'm requesting. I think it relates to this amendment.
Okay. And Representative Ward?
Madam Chair, the best I can do is we can try to get that information in the future. I don't have that information with me today, and we can try to get it in the future. I don't see Mr. Morocco here at all either, so that's the best I can do is try to get it to you in the future. I know that doesn't help for today, Representative Johnson, but your point is well taken. And Representative Loeffler's point about this plan is difficult for the, as you have said, Representative Loeffler, for the cafeteria folks and the ESP folks as well. So let's have further dialogue.
Okay, on the list, on the amendment, Representative Schoen.
Madam Chair, is this just on maybe Representative Johnson's point, is this going to finance too?
Just fine.
And that's
Representative Schoen, and my understanding is it's got several stops to make. It is going to go to finance at some point.
Okay, and then Madam Chair, to the amendment, I share Representative Loeffler's angst of the high deductible health care plan as a single parent who has a couple kids was on one of those. I absolutely it was one of the worst things ever designed as far as I was concerned at that point. But when I didn't have my kids on there, there was some good reasons to be on it. And my only concern with your amendment here is, well, there's multiple, but if someone has if a district is self-insured, I would assume that they can offer any plan they want, and it would be the same. So we're not capturing those folks amongst this amendment, and I'm not sure that maybe we should, because it's tying them a little bit more than even maybe I would like to, and I would like high deductible plans to go away altogether. So I guess how do we, and if there's just no money for it and this is the only plan available, then how do we, I think it's a pretty big grab, and it kind of concerns me, but what is I just want to make it very clear, what do the teachers and the folks that are going to participate in this think about that particular amendment then?
Oh, Representative Ward.
Madam Chair, thank you. Members, and again, Representative Loeffler and I had good conversation about this, and the members want to vote for this. If the members want to vote for this, members, I'm fine with it. So I'll just leave it at that.
All right, we've got Representative Grunhagen, and then Representative Loeffler wants to finish up with a conversation, and then we'll vote on the amendment. Representative Grunhagen.
Oh, thank you, Madam Chair. I sell health insurance and for about 30 some years. And, I identify Representative Schoen's comments and also the testifier from Education Minnesota is that, people have the ability to weigh the consequences of the plan that they're selecting. And like Representative Schoen said, in one situation, when he was single and healthy, it turned out to be a good deal for him. And in the next one, he realized that probably wasn't the plan. One thing about higher deductible plans, you generally, from an industry standpoint, you get lower utilization, okay? And as long as your preventative is covered up front. And one of the problems with lower deductible copay plans is you get higher utilization. And ultimately that drives up your cost inside the plan. So to take this away as a choice, I guess I would not support it, because I think ultimately they're going to be given a number of choices, according to testimony from Education Minnesota, within the PEEP plan already. So why take this choice away when there's some positive things for certain individuals, regardless of where their employment is, that they could benefit from this type of a plan? And I understand where Representative Loeffler is coming from. But I just respectfully disagree with that. And I think by giving them an additional choice, you'll meet the needs of the employees better, and you might reduce unnecessary utilization of the plan, which, to a certain degree, which could actually keep premiums more reasonable for the group as a whole. Thank you, Madam Chair.
All right, thank you. Representative Loeffler, final word on the amendment, and then we'll vote on it.
Thank you, Madam Chair. And I think there's been a little bit of confusion. And I think we do need to remember that when people can't meet their deductibles, it's uncompensated care, it's medical bankruptcy, it's serious consequences, and none of us can predict the future. Any one of us could be in a car accident on the way home, even if we're healthy and young and work out every day at the gym. And so that's the whole purpose of insurance. The other options, I just want to let you know, if you're worried about they don't have enough choices, the other choices under Advantage Health Plan for a family, maximum out-of-pocket is premium plus $3,800. Okay? The value option is premium plus a maximum of $6,000 out of pocket. That is still taking on risk in order to keep a reasonable premium. I just think that premium plus $10,000 is just too much. And so I just want to take the highest cost option off, because I do think it leads to uncompensated care, which is rising insurance rates for all the rest of us. And it's just not suitable, I don't think, for many of our school district employees. So there's clearly affordable other options. The other two options are there. But I think this paying your premiums and then potentially still having $10,000 of obligation is more than I'm comfortable to step up with for our school district employees. I think they expect us to give them a better deal than maybe they were able to get in their own negotiations before, and I think these two plans will do a better job than that third option.
Okay, all those in favor of the A8 amendment, please say aye. Aye. All opposed, no.
No.
The motion prevails. The amendment is adopted. We have the A12 amendment. Whose amendment is that one? Is that yours as well?
That's also mine. And this is the one that provides that right now the bill says that anyone with 1,000 lives, if they're self-insured, have the opt-out. And this just says any school district with 1,000 lives can opt out. And what that does is it says that school districts that are fully insured, that's in the regular market, they're contributing to MCHA, they're contributing to the funding for Minnesota Care, do not get punished for that choice. I think this committee and I in particular really appreciate the fact that we have Minnesota Care and that it has been a safety net for a lot of working Minnesotans, and that MCHA has been available to people with really serious health conditions. And so this amendment just says all school districts that have over 1,000 lives have the same choice, and that we're not going to punish those who happen to participate in the full market.
Okay, questions to the amendment? None. Representative Ward?
Madam Chair, I'm concerned about adverse selection and, having the largest size pool that we can in order to do what we want to do, what we need to do for our school district employees. So I would just ask members to consider that, but vote the way you want to, members.
Okay. Okay, Representative Loeffler.
Thank you, Madam Chair. I just remind members that under the Affordable Care Act, no pre-existing conditions are to be used in weighting things, so our old concepts of adverse selection are really changing. There's still some options, but the ones that we used to think about in terms of you get someone who's needed a transplant or whatever in your pool are really taken care of by the Affordable Care Act.
Representative Zerwas.
Thank you, Madam Chair, and to Representative Loeffler. Am I understanding your amendment correctly that this will allow a larger group to opt out of the PEEP program if they choose?
Representative Loeffler.
Madam Chair and Representative Zerwas, the bill currently, as it's before us, allows groups with 1,000 lives to opt out if they're self-insured. This just says if you have 1,000 lives, you get to with your representatives decide whether or not to opt out. It just takes the full group.
And I guess I'd like to ask a question probably of Representative Ward or maybe Ms. Allschwager. So how many school districts are we talking about here that would be self-insured? What pool size are we talking about that now could potentially opt out fully insured, that if we were to adopt this amendment, what's the impact on the overall pool? Ms. Allschwager.
Madam Chair, members of the committee, Jan Allschwager, Education, Minnesota. I believe when we calculated 1,000 lives, we used that figure, and as we understand it, the insurance industry thinks of one employee as having 2.4 insured lives. So if you're looking at 1,000 lives, if I'm understanding this amendment correctly, that you're looking at about 416 people, 0.6666. And so we don't have the number of school districts across the state that are not self-insured that would meet that threshold. We're not prepared for that today. We could certainly try to find out through the Department of Education. But it would be the school districts that have about 416 employees. And to give you an idea, Hopkins is one of those districts that I think they're at about 1,010 insured lives, I believe. So that kind of gives you an idea about how big a district is.
Okay. Other questions, members, to the amendment? Representative Mack?
Thank you, Madam Chair. And I was just conversing with Representative Morgan over here. Am I missing something? And I could be mistaken. If I line up we're on the A12 amendment, correct?
We're on the A12, that's correct.
I'm just lining up the language, page 4, line 14, and I just don't see those words anywhere in line 14 that we're deleting. But do I have a wrong version of the bill? This was in my packet, but I maybe have a wrong version. I'm sorry.
You may, Representative Macca.
Okay.
I do see it in my version. Are you on 573?
I am. Yep, the one that was in my packet. I apologize, Madam Chair. I'll get the right one.
Okay, so members, the bill that's in my hands, if with the amendment, that line on page 4, that 414 would read, the school board of a school employer, not including a service cooperative under section 123A.21 with 1,000 or more insured lives on the day of enactment, and each exclusive representative of employees of that school employer shall jointly determine whether the employees represented by the exclusive representative will opt out of the program. So it's taking out the individually self-insured. Other questions, members? Representative Johnson.
Madam Chairman, Chairwoman, this may be a naive question of a newbie, but I want to make sure I understand self-insured. Would somebody, a school employer that is self-insured, could somebody give me a definition of that? Is that, I understand that as a school district that has, for instance, a Blue Cross Blue Shield fund.
Madam Chair, I can
And,
explain.
well, actually, I think I'd ask our testifiers to explain that. Ms., is it Lewinsky? Did I get
Yes, Courtney Derwinski.
Lewinsky. Can you explain that?
Sure. Thank you, Madam Chair, members of the committee. A self-funded plan is a plan where the employer is paying the claims out of their assets, as opposed to a fully insured plan where you're purchasing insurance through a insurance company, they're paying the premium, and the insurance company bears the risk of that plan.
Okay, Representative Huntley.
Well, Madam Chair and Representative Johnson, it's a huge topic, and all these, if the company or the school board in this case is self-insured, they are protected by federal laws called ERISA. Don't ask me what ERISA stands for, and which means the state cannot regulate those. And you may think you have a regular insurance, and if you're on CGIP, I don't know which. I have a Blue Cross Blue Shield card, but Blue Cross Blue Shield simply manages the state's employees in this plan, and the state is responsible for any expenses that the employees gather. So the insurance part of it is the company itself. The company is at risk. If they have huge costs, a lot of sick people, then the company, or in this case the school board, pays that, not the insurance company. The insurance company only manages the bills going back and forth.
Okay, Representative Albright.
For the author of the bill, Representative Ward, by the insertion, to Representative Loeffler, by the insertion.
Representative Albright, excuse me, I'm having trouble hearing you. Can you put your mic down a little bit? And I know you have a soft voice sometimes.
I do.
I want the people in the far rows to hear
It
you.
speaks to my demure, temperament.
He's hard to hear sometimes.
Representative, when I look at line 5.1 and I look at the inclusion of the word insured as opposed to self-insured, it strikes me that we are playing favorites. And I say that from the context of, and please correct me if I'm wrong, but it would give choice only to those that have 1,000 covered lives or more. So in the context of, as we heard testimony from two school districts last week, and I don't recall the total number of lives that were covered under those two examples, but you would force them into a choice that is not of their own doing. And as I recall, the competitive bid process that they underwent actually provided them with a better pricing point than PEEP afforded them.
Yeah, Representative Loeffler.
Thank you, Madam Chair, and Representative Albright. My change does not change what is in the underlying bill. The underlying bill, as it's presented to us, does give a choice to those with 1,000 or more lives if they're self-insured. My amendment only says if you have over 1,000 lives, whether you're self-insured or fully insured, you get the choice. So everybody with 1,000 or more lives has a choice. That does not change how the bill in any way treats anyone underneath. But I do think that the large school districts should not be punished and excluded from a choice just because they chose to be in the fully insured market rather than taking on the risk of being self-insured.
Representative Albright, does that answer the question? She's treating the fully insured and the self-insured the same. In other words, she's giving more districts the option to opt out, is what she's doing here.
I understand.
Representative Albright.
Bear with me, Representative Loeffler, then. School employers may opt out only if the total insured lives remain after applying clauses 2 and 4 is more than 1,000 lives. So give me an example of a school district who has 750 employees, insured lives, and has their insurance not with PEEP. Would they still be able to use that alternative source for their insurance, or would they be forced to use PEEP?
Representative Loeffler.
Madam Chair and Representative Albright, that's a question to the substance of the bill, and Representative Ward. My amendment does not affect anyone under 1,000 lives. It only tries to level the playing field for those who are above 1,000.
Right. Representative Albright, I think
between insured and self-insured.
Your concern here, I think, is more to the bill than to the amendment, I think, because what I hear you...
I just want to make sure that insured, from a definition, words have meaning, speaks to, is at a broader context than what we are talking about in the bill, or should it refer to either self-insured or insured based upon the risk that a group that size is willing to take on or not take on?
Okay. I think I understand what you're saying, Representative Albright. Maybe the word insured there isn't the right. I think we're talking about if the total covered lives remain.
Thank you.
Correct? So, Representative Loeffler, would covered rather be better than insured? I understand now where Representative Albright is going.
Madam Chair and Representative Albright, I have always relied on our House Counsel and to do amendments when they understand what the intent is. It could be self-insured and fully insured plans, if you would like. If you felt like that was more clear. My understanding of insurance usage is insured means both. But Mr. Chun, who drafted this, I believe, or else Mr. Pender out of House Research aren't in the room yet, and they understood that I wanted both fully insured and self-insured to be covered the same, and this is the word they chose.
Okay, let's ask Ms. Cleveland here. Maybe she can shed some light on this. Ms. Cleveland, can you help us out?
Madam Chair and members, I think if your intent is to say covered lives, I think that insured does the same thing, but either word could work.
Representative Albright.
Thank you, Madam Chair. And from experience in the insurance industry, from a broader context, the insured might not include self-insured, and so I would appreciate if there would be an opportunity to just replace insured with covered.
Representative Loeffler, you're the author of the amendment, and I think you'll have the final word on that
Thank you, Madam
we hear
Chair.
an amendment to the amendment.
Having consulted with the House research experts who actually know how state law defines it, which is oftentimes different than what common usage in an industry is. I'm more comfortable at this point to stay with their suggested language, but I will be glad to follow up and ask them your question. And since it's going to other committees, I will pass on the information to Representative Ward. But I think we can get this clarified. I'm just not the lawyer, but I trust their judgment.
Okay, we're going to go to Representative Mack, and then we're going to vote on the amendment. Representative Mack.
Thank you, Madam Chair. And just a brief question of clarification, Representative Loeffler. On Friday when we were discussing this, we clarified that districts can opt out if they meet the insured lives threshold, if they're self-insured, and now if your amendment went on, also fully insured. And then if the exclusive representation agreed to opt out. And we clarified with Representative Ward last week that that was a piece of it, that they could still only opt out, even if they met all those other criteria, they could still only opt out if the union or exclusive representative agreed and said, yes, we can opt out. And so I'm just making sure that one piece, that key piece still, so now if this amendment went on, we said fully insured as well as self-insured, and you meet the number threshold, could opt out if the exclusive representative signs off on it. Is that correct? This amendment does nothing to change that one piece, that the exclusive representative would still hold a fair amount of the cards in terms of the ultimate result.
Representative Loeffler.
Thank you, Madam Chair. And yes, I do not change the underlying language, although I think it's important to note under 5.5, it's may negotiate with the exclusive representative, so there's a negotiation process there.
Okay. Representative Ward, I'm going to give you the final word, then we're going to vote.
Madam Chair, just a point to Representative Mack's point. Just to clarify, 1,000 insured lives, self-insured, and if the amendment goes fully insured, and then exclusive rep and employer have to both agree. Not just the exclusive rep, and the employer have to agree in order to opt out. I just wanted to clarify that so that.
Madam Chair.
Representative Mack.
And just briefly to that point, I appreciate the clarification. I guess my concern is, in the case of my school district, if there's a situation the employer, the district is saying something like this, the contracts they get do not make financial sense for them, yet they are in disagreement with their union representation in this, that would put the district in a difficult situation financially. If they know financially it's not a good move for them, but they can't come to agreement with their union, they might be put in a situation. So that's my concern, and I just want to clarify.
Representative Mack, though, the amendment doesn't touch that. Okay, we've got the A12 amendment before us. All those in favor, please say aye.
Aye.
All opposed, no.
No.
The motion prevails. The amendment is adopted. We're on the A10 amendment. Who's got the A10?
Madam Chair.
Representative Benson.
Thank you, Madam Chair. The A10 amendment, basically, it is pretty self-explanatory. On page 5, line 2, after the word lives, you insert this phrase, or if the school employer has received a bid from a source of coverage that provides coverage that is less expensive for equivalent service coverage than coverage available from the program. And the reason I'm introducing this bill is obvious. There are a number of districts, including those that I represent, that have been able to negotiate coverage which would be superior to, or has been superior to, what could be offered or potentially offered under this bill. And those districts would like to keep that option. And I think it would be difficult for members of this committee to vote positively to increase expense for districts that are achieving a better result on their own. Now, I understand, and I think the folks in these districts that I represent ought to understand that they could find themselves in a problem if they have a whole series of major health crises that hit their employees. They can expect they're going to be seeing a change in that coverage in the future. But apparently they're willing to take the chance, and I'm prepared to and willing to help them take the chance. So, Madam Chair, that's the purpose of my amendment.
Okay, thank you, Representative Benson. Representative Ward.
Madam Chair, I've looked at this amendment, and my concern with this amendment, members, is that, somebody said it at the hearing on Friday, oftentimes there's a peak bid, and then all of a sudden an insurance company comes in with a lower bid, and it usually comes in with a lower bid for a couple different reasons. Maybe it, doesn't match up the benefits or the coverage or things as such. And somebody said, where have they been? Where have the insurance companies been? And I ask that same thing right now. A lot of times they'll come in, the insurance companies will come in with a lower bid on a one-time basis using the reserve fund, just to get the bid, and then after that. We've seen the results of what happens after that, and that's why we have House File 573. So I would oppose this amendment, Madam Chair, and members.
Okay, Representative Benson.
Thank you, Madam Chair. Well, that does happen, Representative Ward. I served on a negotiating committee, and that's exactly what happened. An insurance company did come in and offer a lower bid. We accepted it, and then pretty soon, next time it came up, they jacked up the premiums. Then we went to a different company. As I said before, I think the districts that, school districts that I represent understand that those kinds of things happen. They've been involved in negotiations for insurance for 20, 30, 40 years now. That is a good point, and it should be on the record, and I agree that very well could happen. But in spite of that, my feel is every opportunity I have to allow my local school districts or local communities or cities or counties to make decisions, as long as they're prepared to accept the consequences, then I attempt to support local control, and I see that as an example of this. So, but your point is well taken, cannot be argued against.
Representative Grunhagen.
Oh, thank you, Madam Chair. Yeah, I would just simply say I strongly support Representative Benson's amendment. I think it's healthy for school districts to have that type of option and not just be locked into one choice and forced to accept the benefits and premium increases within that. I think we've seen in other states that type of an approach, which this bill takes, does not work very well. And it ultimately creates higher cost and problems for local districts in terms of meeting their budget and providing health insurance in the most cost-effective way. So I would strongly encourage a yes vote for Representative Benson's amendment. Thank you, Mr. President.
Okay. I'm seeing no other questions. We'll vote on the A10 amendment. So all in favor of the A10 amendment, please say aye.
Aye.
All opposed, no?
No.
The motion does not prevail. Division has been requested. All those in favor of the amendment, please raise your hand. All opposed? Are you opposed? Are you voting? 7. Okay, are there abstentions? Okay, so on a vote of 9 to 7, the motion prevails and the amendment is adopted. The A13. Who's got the A13?
Madam Chair, I withdraw that amendment at this time.
Oh, Representative Albright. He withdraws it. Okay, thank you. I can't hear you. Sorry.
Speak up, buddy.
The A14.
Madam Chair.
Representative Albright.
Thank you, Madam Chair. I withdraw this amendment at the time as well.
The A15.
Madam Chair,
Representative Albright.
I withdraw this amendment.
A16.
Madam Chair,
Representative Zerwas.
at this time we'll withdraw this one as well.
Okay. The A16 is withdrawn. A17.
Madam Chair.
Representative Albright.
Thank you, Madam Chair. Also, having been in the benefits field for a number of years, I think it's normal and customary that when a group visits or revisits the issue of the nature and costing for their employee benefits, particularly in this case insurance, with regard to the dynamics that are being played out with the ACA and a number of other features, this amendment moves to strike the 2-year requirement and moves it to a 1-year contract.
Okay, Representative Albright, I assume then that you're going to move the A17?
Yes,
Okay.
I am, Madam Chair.
All right.
I wish to move
Got through that?
A17 amendment.
Okay. All right, so Representative Albright moves the A17. Discussion to the amendment. Okay, Representative Ward. Oh, I'm sorry, Representative Huntley has a... Okay, we'll go to Representative Ward and then Representative Huntley.
Members, most contracts, health insurance contracts are for a 2-year period. The Affordable Care Act, is, as I said on Friday, we are, this bill and the Affordable Care Act, Health Insurance Exchange Bill, are moving side by side. Representative Atkins and I have had many talks about that. Individual district contracts are 2-year contracts as well. And so, I would ask that we keep this as a 2-year contract for those reasons, and I would oppose this amendment.
Okay. All right. Representative Huntley. Sorry, go ahead.
Well, Madam Chair, Representative Ward said pretty much what I was going to say, but if you have to redo and reapply and all that, there's a lot of administrative costs that go along with that. So this would double the administrative cost of setting up this program. So I would vote no.
Okay. All right. Any other discussion to the A17 amendment? All right. Seeing none, we're going to vote on this then. All those in favor of the A17, please say aye.
Aye.
All opposed, no.
No.
The motion does not prevail. The amendment is not adopted. The A18 amendment. Does anybody have the A18?
Madam Chair,
Representative Albright.
I wish to withdraw this amendment at the time.
Okay, Representative Albright withdraws the A18. The A19.
Madam Chair,
Representative Albright.
I wish to move the A19 amendment.
All right, Representative Albright moves the A19 amendment. To the amendment, Representative Albright.
Thank you, Madam Chair. This is a straightforward amendment that provides every school district with an opportunity to entertain a competitive bid process with regard to their insurance. It follows on to the assertion by Representative Benson's amendment, but it tweaks it a little bit from the standpoint that one of the competitive bids needs to be an entity other than from the PEEP.
Okay. Any discussion? I don't know if Representative Ward has had an opportunity to look at this.
Madam Chair, I have not had an opportunity to look at this one. So I'm just looking at it now, Madam Chair. If you want to entertain some questions, I'll weigh in a minute.
Okay. I'm not seeing any. Representative Loeffler.
Thank you, Madam Chair. Maybe it would be useful if the author of the amendment would explain what he's deleting. We can see what the new language is, but there's a lot of deletion here.
Good idea. Representative Albright, if you would.
Thank you, Madam Chair. Some would argue it might not delete enough, but on page 2, it deletes section 2 which goes to the point of the board of discerning the choices. Mhm. Oh, I'm sorry, Madam Chair. The amendment does not include the part of Section 2 on the top of page 3. I apologize for that oversight.
Could you clarify that, Representative Albright? What do you mean it doesn't include it? Please try again.
Section 2, starting on line 2.19, my copy shows that it goes on to the top of page 3 through page line 3.8.
Okay. And Representative Albright, you are working off the first engrossment, correct? You're matching up with what I've got in front of me.
Okay.
But it is the first engrossment.
Right. And then page 4, it's deleting lines 5 through 36 and replacing it with the language on the amendment of 1.4 through 1.7.
Right. Well, Representative Albright, I think we can all read what the amendment is deleting, but what we're asking you is what in fact are you intending to do to the bill here? If you could just explain that to us.
Purely and simply to provide every school district with an opportunity to have a competitive bid process with at least one of the choices provided to the school district of a non-PEEP variety.
So, Representative Albright, maybe you could just kind of tell us what's left of the bill after your amendment, if your amendment would go on.
Section 1.
So that's the definitions.
Then we replace Section 2 with lines 1.4 through 1.7. On page 5, all is removed.
I'm sorry, I didn't hear you.
All is removed?
All of page 5?
Yes.
Okay, so Representative Albright, what I'm understanding here, and maybe other members can correct me if I'm wrong, but it seems to me it basically replaces this bill with another bill that just says that...
Replaces it with the competitive bid process.
Right, that would require every school district to have a competitive bid process for health and coverage. And what I would ask you is, what about the ones that don't offer any? Would you be requiring them to now offer and have a competitive bid process?
They have the choice of going through a competitive bid process or not.
Well, Representative Albright, I don't know if other members are, your language here
If they're providing, Madam Chair, if they're providing coverage, then the competitive bid process would take place.
Okay, so Representative Albright, in what would be left of the bill with your amendment, where does it say that if they're offering coverage?
That's a good question, Madam Chair.
So as I'm reading it, maybe staff can help us here. I don't know if it would be Ms. Cleveland. Ms. Cleveland, can you kind of tell us what would be the bill if this amendment went on?
Madam Chair and members, if the A19 went on, you'd be left with the definitions, and then the replaced language of a new paragraph G, essentially under the public employee participation section, which requires what the language, as it's here on the bill, or on the amendment.
Okay, so as I'm understanding it, Representative Albright's amendment then is going to require every school district to get competitive bids for health insurance, and I understand that to apply to whether they currently offer or not, or whatever their current arrangement is, this would require that.
If
Representative Albright.
Madam Chair, I'd like to offer an oral amendment to my amendment.
Okay, go ahead.
On line 1.4, it should begin by saying, if group insurance is offered by the school district, comma, every 2 years, each independent, and it would go on from there.
Okay, did everybody get that? So Representative Albright is incorporating the following language on page 1.4 after G. He's inserting, if group insurance is offered by the school district. Is that correct, Representative Albright?
Yes,
okay,
Madam Chair.
He's incorporating that change. Okay, I think we're ready to vote on this amendment. So on the A19, all those in favor of the A19 as amended or as with the incorporated change, please say aye.
Aye.
All opposed, no?
No.
The motion does not prevail. The amendment is not adopted. Okay, the DE1.
Madam Chair.
Representative Zerwas.
Thank you, Madam Chair. I'd like to move the DE1 amendment.
All right, Representative Zerwas moves the DE1 amendment.
All right, thank you.
Representative Zerwas.
On Friday when we were discussing this, one of the things that struck me was the comment about instead of, we have the ACA and the health exchange bill that's working its way through that will have administrative costs. We have this bill, which has a premium surcharge for the first several years to set up administrative, pay for administrative costs and administrative charges. And it was brought up about CGIP, the state employee group insurance plan. And someone made the comment, you wouldn't want those people as a part of CGIP. And I think we absolutely would open up CGIP, especially to our school districts that are having trouble with competitive bids because their pool just isn't big enough. And so my thought is, instead of reinventing the wheel and coming up with premium surcharges to pay for an administrative backbone for a new program, why not just insert language that would allow these districts to obtain employee group health coverage through the state employee group insurance plan? It's already established, it's already set up, it already functions. Why not just open the door a little bit wider?
Okay, comments, Representative Ward?
Madam Chair, Representative Zerwas, thank you.
You're welcome.
However,
I thought I had it.
However, Representative Zerwas, members, this basically, replaces CGIP. It doesn't allow our members to go into PEEP if this bill passes, thereby taking away some of the decision-making by them, some of the benefits that they get from PEEP on that. So, members, I'm just going to oppose this. I appreciate the amendment. I appreciate your offer. PEEP has established record of very good health insurance coverage for their members, and that's the program that we've selected in order to move forward with this bill. Thank you, members.
Okay, Representative Mack.
Thank you, Madam Chair. And Representative Ward, just to clarify your statements, could you explain to me what they'd have access to under PEEP that CGIP wouldn't provide them or wouldn't afford them, the advantages that you mentioned that come under PEEP? Could you explain that to me?
Ms. Dewinski.
Yes, thank you. Madam Chair, committee members, there are within PEEP different plan design options that don't exist in the CGIP program, and the purpose of that is just that there's a wider variety of plan needs in the school districts in the state.
Okay, Representative Mack.
Thank you, Madam Chair. So just to clarify, and I don't know the numbers of how many are in PEEP versus how many are in CGIP, but are you saying that there's a unique need or case mix or within the teachers and folks that districts would be putting into PEEP versus the wide variety of issues and needs that exist in CGIP across all state employees? There's a unique set of needs within this pool of people. Is that what you're saying?
Ms. Dewinski or Ms. Allschwager?
Madam Chair, Representative Mack, the reason that you need that middle level plan for school employees is because many school employees could never afford to go into a plan like the one you have because their premiums are so expensive, they have been ill, they don't have the community in their pool that is well enough to afford a richer benefit. And so if you look at the benefit sets across the state in the districts, you will find a lot of them that cannot even consider jumping to the benefit plan that you have because it would be too costly. Many of them have the HSAs, or if they were to go into PEEP, some of them would choose the middle plan.
Okay. All right. I think we're ready to vote on the BE1. Who's Representative Zerwas?
Thank you, Madam Chair. And I think with the changes with the ACA, I think the pre-existing conditions we know and we've talked about on Friday that isn't a factor in the costing of this anymore, and so we want to make sure we're accurate on that. And as we look out, I want to think, what are we trying to accomplish here? Are we saying that we can't provide these small districts don't have a large enough pool, and so we want to provide them a large enough pool? Then I say we have CGIP and they can jump in because it's a big enough pool, everyone can go swimming. But if we're looking at creating a new bureaucracy and a new thing to manage, then I think that's the direction that this bill goes. So what's the goal? Is it to provide more coverage? Because if it is, I think CGIP can do it, and it can do it efficiently.
Representative Huntley.
Well, Madam Chair, this would certainly put a fiscal note on this bill. And so it's going to have to go to some finance committee. I'm not sure which one. But CGIP is paid entirely by us, and if there's additional cost because of adding the public school systems to CGIP, somebody's going to have to pay for it in their budget this year.
Okay, thank you, Representative Huntley. Representative Johnson.
Madam Chairwoman and Representative Zeros, I'm intrigued by this idea because I think the whole idea is to create a large pool, and I am a long-time member of CGIP. I'm pleased with that, and I think the opportunity to expand it to include all public employees in the state has merit and deserves a look. And I'm a little, I'll be honest, I'm frustrated with the process. I've been here, 3 or 4 weeks. And well, this is my frustration with the process, in that I consistently see us racing to make a decision, and I'm told I have to accept that. But here's a possibility where a better idea is presented, but it needs time. And it's a lot more complicated than this, because it's not only the issues that Representative Huntley mentioned about there's a possibility of costs. The negotiation process for this plan is significantly different than what I perceive the negotiation process would be with PEIP, in that the negotiation process is done with representatives of multiple unions that are state unions. And I don't think it would be fair to ask Ed Minnesota or the other unions associated with public schools to have their plan totally negotiated by state unions. The second thing is, and this is where I think that we might be missing a boat on, is that as a public employee, really the health care negotiation is pulled out of our contracts by this agreement. It's a separate thing. We don't get bogged down in the health care discussion. The health care discussion of our contracts is really quite separate. And frankly, I see that as an advantage to the bargaining process. I think there's some hope with that also with PEIP, but the additional choices that I'm perceiving, I'm careful with my language because it's hard to grasp it all, but there's some of that, but the choices that are demanded by different districts paying different percentages and different roles, they're not afforded to that, whereas as state employees, we are afforded that. My point being is that there's an advantage with this, and I really compliment you. I think there's a good idea here. I'm interested in large pools. I'm interested in clean processes that embrace as many workers in Minnesota as possible. I'm even open to the idea of expanding plans beyond the public employees. Can we get to a point where we can have a Minnesota Care insurance that would really absorb the entire pool of this state? Can we do this really creatively? I'm arriving late. I think the horse has left the barn, and I may be way out in another look on it. But I do want to recognize this as a possibility. My other frustration that I do want to say is that when this is presented to me, you know, I saw this for the first time, and I understood this now, and now I got to vote on it. There's no really good way to absorb what that means. So it's very hard to support this kind of a change when a bill has come in this well-studied and well-prepared. And I would just hope that as we're working with these decisions, these affect the real lives of real people and their health care, that we somehow find a way that when we get a creative idea like this, to absorb it in the process far earlier so it can be examined, can be considered, and we might come up with a much better product. This is my moment to share that frustration. It's been building over several weeks. I don't think we'll change it, but I got to share it. Thank you very much.
All right. Well, thank you, Representative Johnson. And you could always file a bill, and that Representative Zerwas can file a bill, and this is essentially a different bill. Representative Benson.
Thank you, Madam Chair. Just a quick question to Representative Zerwas. It's been my understanding that teachers are just about the last group anybody else wants to be in a pool with. And the reason is they have a lot of health problems. I spent 35 years in the classroom, and I can understand. I did escape with most of my health, but a lot of people don't. So have you talked, my question is, have you talked to the other work groups or unions who would be part of this pool that you're suggesting, whether they want teachers in? I don't think they do.
Representative Zerwas, and he was on the list as well, so why don't you finish up and then we'll vote on this amendment.
Fantastic. Thank you, Madam Chair. And real briefly, Representative Benson, I think our goal should be to provide as cost-effective and effective health care for as many people as possible. And I don't see teachers as the lepers of the insurance market that you may. I think I was in through 1993 to about 1996. I had 4 heart surgeries in 3 years and waited for a heart transplant. Trust me, the city of Elk River switched insurance plans quite often. My family was the leper of the city of Elk River's insurance plan. But that's because we had a small pool. We had a group of under, I think it was at that time, about 65 employees for the city of Elk River that were a part of that insurance pool. That's where the issue comes from, is the small pool. I think if we open this up, and we have to think of what our goal is. Is our goal to provide effective, efficient, affordable health care to as many people, or is it to give something, some group a wedge in a union negotiation? Because we can give them a big hammer and an anvil and let them bang on each other, and we might get to good health care. Or we can open up the systems we already have and say, well, we can take care of everyone. And we can do it efficiently, and we can do it cost effectively. That's I think we have to step back and say, what are we trying to accomplish?
All right, we're going to vote on the DE1 amendment, and I think that's in fact what this bill is trying to do. The underlying bill is trying to get some efficiencies here. So all in favor of the DE1 amendment, please say aye. Aye. All opposed, no?
No.
The motion does not prevail. The amendment is not adopted. We have one more amendment, and that is the A9.
Madam Chair, I would like to withdraw that amendment.
All right. Representative Benson withdraws that amendment. We are on the House File 573 as amended, and I'm going to renew the motion that House File 573 be recommended to pass and re-referred to the Committee on Government Operations. So, Representative Mack?
Thank you, Madam Chair. Just one quick question for the author, and this is back to something we talked about on Friday. And I was thinking about it and wanted clarification. One thing we had talked about was the interaction of the exchange and this bill, and a lot moving forward with a lot of unknowns. And one thing that you had mentioned at the time was that this, unlike the exchange, could provide, I think the word you said, because I jotted it down, is immediate relief or immediate help to the districts that need it most. But as I look at this bill, it's enacted on January 1st of 2014, the same time that the exchange is. So I guess I just wanted clarification on that comment. It didn't make sense as I mulled it over later on. I guess it just gets back to my issue of why do this when we already have the exchange moving forward, and if your response was correct and that's what you meant, I guess I'm just looking for clarification.
Representative Ward.
Thank you, Madam Chair. Thank you, Representative Mack. What I meant by that, Representative Mack, was that, what in this bill does take enactment in January 1st of 2014. The state health care exchange also does, but it does not allow large school groups in at that point until 2017, another 3 years later. So we have 3 years where we have some potential savings for our educational employees and our state and our taxpayers, maybe even invest in education again. Wouldn't that be wonderful? So that's a clarification on that, and I appreciate it. I also, Madam Chair, if I might, Representative Mack, if you have a follow-up, I'll get to it in a minute, but I'm interested in Representative Benson's comments about nobody wants the teachers, probably because Representative Benson, they have heart attacks and things like that you're familiar with. But in all seriousness, I would like to see where that kind of documentation is. I mean, that says educators are at a bad risk or whatever. Because when we make statements like that, I think that we need to make sure that that's validated as well. So, Representative Mack, I hope that clarified your point as well.
Yeah, thank you very much. That does clarify it. I appreciate that. And Madam Chair, just wanted to ask for a roll call on the bill.
Okay, there will be a roll call. So Representative Grunhagen also had his hand up. I'm going to take your comment. I'm going to let Representative Ward finish, and then we're going to vote. Representative Grunhagen.
Thank you, Madam Chair. Yeah, just a couple quick questions. One, I appreciate, just a comment first. I appreciate Representative Benson's amendment. I hope it can stay in the bill through conference if it gets that far. Secondly, and I guess I'd address this to the author, could you leave a massive unfunded liability in the general fund if losses are excessive inside the PEEP program? Who backs up the losses if it has a bad year, or one of the testifiers?
Representative Ward.
Madam Chair, part of that answer is there may need to be some premium increases to pay for some of the losses or whatever. You never know. I came from a district that had a catastrophic event. Representative Zerwas talked about that. We had a football coach that had an aneurysm on the first football game of the year that was catastrophic to our pool. And so part of it would and so we had to learn how to make sure that our insurance pool, that our insurance coverage, covered that as well as the rest of us. And so, through some reserves, perhaps through some surcharge, we hope not, but perhaps there is a clause in there about borrowing from the insurance trust that would need to be paid back. So. Nobody can predict the future. We never knew that coach was going to have an aneurysm on the sideline, and was as of retirement age at that point. So we hope that never happens to anybody. But we have put some measures in this bill to try to address those concerns.
Madam Chair.
Okay, we're going to finish, Representative Grunhagen. We're out of time now. So we're going to, unless Representative Ward wants a final word, which I think you kind of just had, but you want to say one more word?
It's a good bill. Vote for it.
All right, thank you. The clerk will take the roll.
Chair Liebling,
Yes.
Vice Chair Moran, Representative Moran, Representative Mack,
No.
Representative Abler, Representative Albright,
No.
Representative Allen,
Yes.
Representative Benson,
Yes.
Representative Franson, Representative Fritz,
Yes.
Representative Grunhagen,
No.
Representative Huntley,
Yes.
Representative Clark Johnson,
Yes.
Representative Loeffler,
Yes.
Representative Lomer,
No.
Representative Morgan,
Aye.
Representative Mullery,
Aye.
Representative Schoen,
Yes.
Representative Schumacher,
No.
Representative Ward.
Yes.
Representative Zerwas.
Both wards vote.
There being 12 ayes and 7 nays, the motion prevails and the bill is passed to government operations. Thank you, Representative Ward.
Madam Chair.
So, members, we are going to stand in recess till the call of the chair, and we'll reconvene approximately 6 p.m. Now, listen, it's not the same room. 300 South. Okay, we will meet in 300 South at 6 o'clock p.m. So we stand in recess.